Here is a detailed overview of vancomycin, suitable for healthcare professionals or advanced nursing/pharmacy students. Vancomycin Comprehensive Drug Monograph. 1. General information. Generic name vancomycin. Drug class glycopeptide antibiotic. Drug forms intravenous powder for solution, intravenous solution pre-mixed, oral capsule, oral solution for vanc. Brand names Vancomycin, Furvanc, Vancomycin HCl injection, generic. 2. Definition. Vancomycin is a tricyclic glycopeptide antibiotic used primarily to treat serious or severe bacterial infections caused by gram-positive bacteria, especially strains resistant to beta-lactam antibiotics such as MRSA, methicillin-resistant Staphylococcus aureus, and C. difficile. It is often reserved for severe infections due to its potential nephrotoxicity and ototoxicity. Have 3. Mechanism of action. Vancomycin inhibits bacterial cell wall synthesis by binding to the D-ala terminal of peptidoglycan precursors, preventing the transglycosylation step in cell wall biosynthesis, resulting in inhibition of bacterial cell wall construction, leading to lysis and death. Type of action, bactericidal against gram-positive organisms. 4. Indications. Intravenous IV use, MRSA infections, sepsis, endocarditis, pneumonia, especially hospital-acquired, bone and joint infections, e.g. osteomyelitis, skin and soft tissue infections, surgical prophylaxis in penicillin-allergic patients at high risk. Oral use, not absorbed systemically, Clostridium difficile, C. difficile infection, pseudomembranous colitis. 5. Contraindications. Known hypersensitivity to vancomycin or any component of the formulation. Caution in patients with renal impairment, hearing loss or auditory impairment, concurrent nephrotoxic or ototoxic drugs. 6. Before taking this medicine, precautions. Patient assessment, before therapy, baseline renal function tests, e.g. serum creatinine, BMAN, hearing assessment, if prolonged therapy is planned or if the patient is elderly. Review concurrent medications to assess for nephrotoxic or ototoxic risk. Special populations, pregnancy, category B, use only if clearly needed. Lactation, present in breast milk, use with caution. Elderly, higher risk of nephrotoxicity, monitor renal function closely. Pediatrics, dose based on weight and renal function. How to use, IV administration, administer slowly over at least 60 minutes, 1 gram dose, or longer for larger doses. Use central line if possible to reduce risk of phlebitis. Dilute according to institutional protocols. Oral administration. Take with or without food. Shake oral solution well before use. Used only for C. difficile infections, not systemically absorbed. At 8. Dosing information. Intravenous systemic infections. Adults. Initial dose 15 to 20 milligrams kilogram every 8 to 12 hours. Target trough level 10 to 20 milligrams per milliliters based on infection severity. Pediatrics 10 to 15 milligrams per kilogram every 6 to 12 hours. Adjust for renal impairment and monitor serum levels frequently. Oral for C. difficile. Mild to moderate infection 125 milligrams orally every 6 hours by 10 days. Severe infection 250 to 500 milligrams orally every 6 hours. Recurrent infection pulsed or tapered doses as guided by IDSA guidelines. Misdose and overdose. Misdose. Take as soon as remembered unless it is near the time of the next dose. Do not double dose. Overdose. Symptoms: renal failure, ototoxicity, hypotension, lactic acidosis. Management. Supportive care. Discontinue drug. Hemodialysis may help in removal. Vancomycin is dialysable. Monitor renal and auditory function. MASH 10, when to stop or avoid taking. Signs of a severe allergic reaction, rash, swelling, difficulty breathing. Red man syndrome during infusion, slow infusion rate or premedicate with antihistamines. Development of nephrotoxicity, rising creatinine, or ototoxicity. Severe thrombocytopenia or leukopenia. Nutshell 11, side effects in detail. Common, infusion-related reactions, red man syndrome, flushing, rash, hypotension, injection site pain or phlebitis, chills, fever, gastrointestinal oral form, nausea, abdominal pain. Serious adverse effects: nephrotoxicity, acute kidney injury, higher risk with prolonged use, high doses, or concomitant nephrotoxic drugs. Ototoxicity: tinnitus, hearing loss, rare but possible especially with high serum levels. Neutropenia, thrombocytopenia, Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis N, hypersensitivity reactions, e.g. anaphylaxis, interstitial nephritis. 12. Vital information, clinical pearls. Trough levels should be monitored. Mild infections, 10 millisecond per milliliter. Severe infections, e.g. MRSA, pneumonia, meningitis, 15 to 20 milligrams per ml. Infuse slowly to prevent red man syndrome, 1 gram over at least 1 hour. Monitor renal function regularly, especially in elderly and critically ill. No systemic absorption from GI tract, oral form only effective in gut lumen. Rotate IV sites to reduce risk of phlebitis. Monitor for signs of superinfection, e.g. fungal overgrowth. 13. Drug interactions, drugs that increase risk of nephrotoxicity, ototoxicity. Aminoglycosides, e.g. gentamicin, amikacin, loop diuretics, e.g. furosemide, NSAIDs, e.g. ibuprofen, ketorolac, amphotericin B, cisplatin, tacrolimus, cyclospor. Other interactions: cholestyramine, binds to oral vancomycin, reducing efficacy in C. difficile treatment. Anesthesia agents, increased risk of histamine-like reactions when vancomycin is used perioperatively. Thank you. Have a nice day.